Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're continuing our series on hereditary angioedema, or HAE, a rare and potentially life-threatening condition marked by unpredictable swelling attacks that can involve the skin, gastrointestinal tract, or even airway. These attacks result from a deficiency or dysfunction of C1 esterase inhibitor, leading to bradykinin-mediated swelling rather than histamine-driven allergy. Because of this unique biology, HAE requires targeted therapies. So far in this series, I have covered nearly all FDA-approved preventive options, as well as the first oral on-demand HAE therapy, Icatibant, approved in 2025. If you have not seen those episodes yet, you will find the links in the description below. Today, our focus shifts to Firazyr, an FDA-approved subcutaneous on-demand therapy for acute HAE attacks. Since 2019, multiple FDA-approved generic versions have become available in the United States, making Icatibant one of the most commonly used rescue medications for HAE. Even today, Firazyr remains a reliable and effective treatment option for acute HAE swelling. In this video, I will walk you through 5 key things you need to know about Firazyr: what it is, how it works, how it's administered, important warnings and interactions, and its safety profile. If you're new here, don't forget to like, subscribe for more evidence-based medical updates. Now, let's dive in. First, what exactly is Firazyr and who it's for? Firazyr, also known by its generic name Icatibant, was approved by the FDA in August 2011 for the treatment of acute HAE attacks in adults 18 years of age and older. Firazyr can be used for skin, stomach, and throat attacks. It is designed for rapid use at the onset of swelling and can be self-administered after appropriate training. For patients who are already on long-term preventive therapy, Firazyr plays a critical role as a rescue medication for breakthrough attacks, ensuring patients are prepared when unexpected swelling occurs. Second, how does Firazyr work? In patients with HAE, deficient or dysfunctional C1 esterase inhibitor leads to uncontrolled activation of plasma kallikrein. This results in excessive production of bradykinin, a potent vasodilator that increases vascular permeability, allowing fluid to leak into surrounding tissues and cause pain and swelling. Firazyr works by directly blocking bradykinin at the B2 receptor. By binding to this receptor, it prevents bradykinin from acting on blood vessels during an acute HAE attack. Interrupting this final common pathway allows Firazyr to rapidly reduce swelling, pain, and inflammation. Instead of replacing a missing protein upstream, Firazyr acts downstream by targeting the key mediator responsible for symptoms, making it very effective once an attack has already begun. Third, let's talk about dosing and administration. Firazyr is administered as a 30 mg subcutaneous injection, typically into the abdominal area upon recognition of an HAE attack. It is supplied as a single-dose prefilled syringe and is intended for self-administration once the patient has been properly trained by a healthcare professional. The injection should be given slowly over at least 30 seconds. If symptoms do not adequately improve or recur, additional 30 mg injections may be given at intervals of at least 6 hours, with a maximum of 3 doses in a 24-hour period. People with HAE, including those on preventive therapy, are strongly encouraged to keep enough acute treatment for 2 attacks, or at least 2 doses on hand to be prepared if an attack happens. Detailed preparation and injection instructions are provided in the instruction for use section of the package insert and on Firazyr.com. These instructions should be reviewed carefully, and injection should only be performed after appropriate training. Fourth, let's review important warnings, drug interactions, and generic availability. Because of the risk of airway obstruction during throat HA attacks, patients should seek immediate medical attention in an appropriate healthcare facility in addition to treatment with Firazyr. Firazyr blocks the action of bradykinin and may interact with a class of blood pressure medications called ACE inhibitors, such as the Lisinopril, Enalapril, and similar drugs, potentially reducing their blood pressure lowering effect. Although clinical trials excluded patients taking ACE inhibitors, this possible interaction should be considered in routine clinical care. Many FDA-approved generic versions of Icatibant are now available. Generic medications contain the same active ingredient, strength, dosage, and indication as the brand name drug, and must meet strict FDA standards for quality, safety, and efficacy. While generics may differ in appearance or packaging, they are considered clinically interchangeable with a brand name product and may be available at a lower cost. And finally, let's review side effects and safety. Injection site reactions are the most common side effect and occur in nearly all patients. This may include redness, bruising, swelling, warmth, burning, itching, irritation, hives, numbness, pressure, or pain at the injection site. However, the reactions are generally mild to moderate in severity, short-lived, and resolve on their own. Other less common side effects reported in clinical trials include fever, elevations in liver enzymes, dizziness, rash, nausea, and headache. Long-term safety data from an open-label study were consistent with findings from control trials, and the safety profile was similar whether injections were self-administered or given by a healthcare provider. Tiredness, drowsiness, and dizziness have been reported following the use of Firazyr, and patients should avoid driving, operating machinery, or do anything that needs to be alert if these symptoms occur. Post-marketing reports have included urticaria, but the frequency and causal relationship remain uncertain. Importantly, no hypersensitivity or anaphylactic reactions were reported in clinical trials. And there we have it, 5 key things you need to know about Firazyr. The first prefilled, self-administered subcutaneous injection approved to treat acute HA attacks. With no reconstitution, no dose calculation, and no refrigeration required, Firazyr is ready to use as soon as symptoms begin. By directly blocking bradykinin at its receptor, it delivers targeted, rapid symptom relief and remains a cornerstone rescue option now widely available in both brand and generic forms. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.